I'm an anaesthesia associate. I've been an anaesthesia associate for 16 years. And I also speak as a PA educator. One of the things that's come out of this, from my experience as an educator, where I work here, is I've also taught other professional groups. This is the hardest course I've ever taught, including advanced clinical practice, where I wrote programs. The training we put PAs through is hard. I don't have a medical degree. It is hard. The competencies we ask of these wonderful clinicians, these wonderful students, is much, much higher than any other professional group. And I'm talking about nursing, I'm talking about paramedicine. As a health professional, and that's what I want to be regulated as, and recognised as, I'm also a biomedical scientist. I read the pool report and I listened to you when you announced it. I was gutted, and I'm saying this quite personally, but I've also found that you've said about not putting people in boxes. By recommending the RCOA scope of practice, which excluded any input from any health other professional other than doctors, I now can't serve the patients that I used to serve. So it now means every week we have 2 lists of breast cancer women who cannot be operated on because we do not have the staff. We have 10 cardioversion patients who now can't be done because we don't have the anaesthesia associates to support that, and then seen as service delivery and not training opportunities for the junior members of staff. So we've increased the health inequalities, we've reduced access to care, and we've reduced people like myself backwards. And that's been really difficult. And I've certainly found that for my students as well, that, as been said, we are regulated by the GMC. I've waited a very long time for that. All I ask is that I'm recognised as a healthcare professional, like any nurse, any paramedic, or anybody else. I do not mind supervision. That's exactly what I should do. If I'm not sure, or if I've got a question, I will absolutely go speak to my consultant. Every PA and AA that I know does exactly that. Everybody does it.
But that's not the same as supervision. It's not the same as supervision.
But having that to be there to go and talk to is supervision. And that pathways that we've talked about have actually been retrograded. The evidence has been lost. There's a lot of solo evidence where a lot of, because we're so small in number, there's 1 or 2 PAs, 1 or 2 AAs, and that was entirely removed from the data that you looked at in your own words. And I found that really hard because for a long time I was the only AA in my trust. And my data was ignored, which showed that we opened healthcare, we increased the number of patients that were able to be seen and operated on at a time when the NHS, particularly in theatres, has the greatest need for efficiencies and utilisation. We also help when there's an emergency. And I think there's been a fundamental lack of understanding of what the opportunities are for this health professional group. But more than anything, I just want to be recognised as a healthcare professional in my own right.
And I do too. I want you to be recognised. So I'm sorry you felt gutted. And I didn't intend things that were in place and working well to be unpicked. But that wasn't my intention. And I hear what you've said. And I do think we should be healthcare professionals in your own right. And the bit about supervision is the fact it's not well understood. And all of us goes to other people in a team to ask for help and advice. We all need to do that. That's not the same as supervision, which is ongoing supervision that you might have if you're in training, you're in a supervised role. That is different, and that's what I wanted to move away from. You are professionals in your own right. People recognise what you're good at, what you can do, what you can add. That's what I wanted to achieve. And I'm sorry you've had a difficult time.
Unfortunately, you failed in that. And I think any UK PA or AA, and I will continue to use my AA title because that is what I'm registered as, feels betrayed and feels, I feel saddened, and I can no longer do what I have done, and that guts me.
Is there anything I can now do, because that wasn't my intention, and you know, and I think, I write a report. That's not about the implementation of it. We haven't actually thought about how it should be moved forward. I would like some of this work to happen, but is there anything I can do now?
I think looking at your job descriptions is certainly useful. Looking at some of your recommendations, particularly regarding AAs and the RCOA, is dangerous, quite frankly. But I also think the recognition that actually PAs and AAs need to be involved, and that has not happened. The one thing this report screams is a failure of medical leadership, not us. Failure of medical leadership to know how to lead, and that's what's failed.
And that is in the report. The absolute need for medical leadership. I absolutely agree with you.
Research for medics. AAs and PAs have been excluded from the research fields purely because we are on the ground 100% of the time. We don't get SBA time, we don't get audit time, we don't get research time. And even as an academic, we struggle. So that is something that has to come, is that AAs and PAs are given that time to develop, given that time to support research, to look exactly what you said about AAs. I wrote an email 18 months ago to my colleague, and Prof was aware of it, suggesting exactly that. But it's having the time to do it, and that's unfortunate when you're so focused on patient care. We're excluded from QIPs, we're excluded from QA activities because medical doctors are prioritised for those roles and that time and that protected teaching, and that in the NHS is what's failed. So we support our staff and we support our colleagues, and we recognise that supervision is important, absolutely. But I think the way the report has been written and has been interpreted has actually gone against what you've said today. Oh yes.
Thank you for your comment. I'm happy to.
I'm going to draw it to a close for time only. Gemma, thank you so much for that question. Appreciate that. I'm sorry, I'm going to have to draw the session to a close because otherwise we're going to be running way over time. I know that Jill's going to be around, and I'm sure we'll engage in conversation. I want to thank Jill for coming today and for owning the report, and actually for presenting in such a way, because I think that it's not just about what Jill has done and what the report's done, it is about what we were talking about, just implementation. And I think that's the point where I feel that NHS England have not actually supported the recommendations, or indeed understood the recommendations. I really firmly believe there was a knee-jerk reaction to the report, which has been incredibly unhelpful. And it may sound political, I don't mean it to sound political, but the fact is NHS England are the National Health Service executive who set the standards, who set the guidance, who set everything on a track, and I think they've wholesale let everybody down because they have not understood the fundamentals of the report and actually how to implement it. So I think that there is a significant discussion, and the GMC, NHS England, Department of Health and Social Care and the PA Schools Council are in the process of arranging meetings to try and work our way through this, because the fact is that without the clarity and without the consistent application of it, we're seeing PAs and AAs across the UK being disadvantaged significantly. But I do want to say a sincere thank you.